I'd venture to guess that almost every major healthcare delivery organization these days is investing on some level in healthcare technology. And the question is, what's the best investment for them? We wrote this digital health selection framework in order to help organizations to have a better way of assessing their digital health platforms, what they're actually choosing, technologies that they're implementing, to help choose them, select them, and then implement them in their healthcare environments. And we chose as the orienting theme the triple aim, depending on the organization, depending on the population that they serve, and depending on what they've already built up in terms of health technology investments. This health technology selection framework should help guide them towards making decisions about what technology investments they need to be making in the future based on their pursuit of various dimensions of the triple aim. We talked to some healthcare delivery organizations that had over 150 pilot tests on various technologies going on at any given point in time. I had no idea that there were 150 different categories or companies that were producing technologies that might be relevant to a specific healthcare delivery organization. So the sheer number of investments that big healthcare delivery systems are making these days was one of the most surprising findings. I think the other thing that was a little surprising was how few of these technologies really aimed at all three components of the triple aim. We found very, very limited number when we looked across the board, very few that actually addressed all three dimensions of the triple aim. We found a lot that had a direct, or that tried to have a direct impact on population health, but very few that took on costs and patient experience in tandem as well. We speculate that these companies, A, may not be particularly familiar or completely aware of the triple aim at this point in time, and B, that the transition still is, we're still undergoing the transition in our healthcare environment from a predominantly fee-for-service environment to a value-based healthcare delivery system. Technology is going to be a big part of our healthcare environment moving forward, and I think moving us towards the triple aim is the ultimate goal for the health of any population. And so if technology is a big part of that market environment, we've got to figure out a way to leverage it to help us get there.